Hello and welcome to our channel. It is indeed a pleasure to have you with us today. Your presence suggests your curiosity, and we are geared to satisfy it by immersing ourselves into the intriguing domain of Viagra. We'd like to take a moment and encourage you to engage with our community. This community comprises intelligent, curious individuals like you who are not just viewers but active participants in our journey to explore and learn. Hence, we urge you to utilize the like and share buttons. It is through these simple actions that you contribute to the growth of our channel and help us reach others who share your inquisitiveness. Subscribing to our channel is another simple yet significant action you can take. Each click on the subscribe button not brings us joy but also motivates us to do better, to bring you more engaging, informative videos like this one. So we kindly ask you to activate notifications. So from the bottom of our hearts, we want to express our sincere gratitude for your continued support. We appreciate every single interaction and look forward to growing together. Now, without further ado, let's get started with our deep dive into the world of Viagra. Ever wondered how Viagra really works or what it does to your body? Well, let's set the stage. You've probably heard of Viagra, the small blue pill that has made waves in the world of men's health over the past few decades. Known scientifically as sildenafil, Viagra is primarily used to treat erectile dysfunction, a condition that affects millions of men worldwide. But it's not just its medical use that makes it a topic of interest. Over the years, Viagra has garnered a fair amount of attention, climbing its way into popular culture and sparking conversations far and wide. It's been hailed as a miracle drug, vilified as a crutch, and endlessly joked about. But what's the real story? What's the science behind this little blue pill? And most importantly, is it right for you? Today, we'll delve into 12 things you should know about Viagra. So sit back, relax, and let's dive in. Viagra has an interesting history that many people are unaware of. It's a story that begins not in the bedroom, but in the laboratory. The blue pill we know today was initially a product of pharmaceutical giant Pfizer's research in the late 1980s and early 90s. Their goal? To develop a new treatment for angina, a heart condition associated with chest pain. But in the clinical trials, something unexpected happened. The drug showed minimal effect on angina, but it did have an interesting side effect. It significantly improved erectile function. This surprising discovery led Pfizer to change course. They decided to repurpose the drug, now known as sildenafil, for a condition that had long been neglected in medical circles, erectile dysfunction. And in 1998, sildenafil, under the brand name Viagra, hit the market and changed the face of men's health forever. From heart medication to a solution for erectile dysfunction, Viagra has had quite a journey. So how does Viagra work in our bodies? This question may have crossed your mind a time or two. Well, it's all about science, specifically the science of blood flow. Viagra, or sildenafil as it's known in scientific circles, is a type of drug called a PDE5 inhibitor. In layman's terms, it's a chemical that blocks the activity of an enzyme called phosphodiesterase type 5. This enzyme is responsible for regulating blood flow in various parts of the body, including the penis. Now let's dive a bit deeper. When a man is sexually aroused, nitric oxide is released into the penis. This nitric oxide triggers a series of reactions resulting in the production of a substance called cyclic GMP. This substance is key because it relaxes the smooth muscle cells in the penis, allowing blood to flow more freely into the area. But remember our friend the PDE5 enzyme? Its job is to break down cyclic GMP. So in a normal scenario, once the sexual stimulation ends, PDE5 breaks down cyclic GMP, the smooth muscle cells contract again, blood flow to the penis decreases, and the erection subsides. Viagra enters the scene by inhibiting PDE5, which means it slows down the breakdown of cyclic GMP. With more cyclic GMP present, the muscle cells remain relaxed for a longer period, thus enhancing and prolonging the erection. It's important to note here, though, that Viagra doesn't create an erection out of thin air. Sexual arousal is still necessary to kickstart the whole process. So think of Viagra as a supportive friend, not a magic wand. It doesn't cause an erection, it simply aids the natural processes that lead to one. It's like giving a boost to a car that's already in motion, not starting a car that's not running. In summary, Viagra works by bolstering the body's natural mechanisms that control blood flow to the penis. It enhances the effects of a substance that relaxes muscles, in the penis, thereby improving blood flow and helping to maintain an erection during sexual activity. So essentially, Viagra enhances the natural processes that lead to an erection. But just how effective is Viagra? That's a question many people ask. The answer lies in numerous studies, each highlighting the potency of this little blue pill. One study from the Journal of Sexual Medicine reveals that Viagra, or sildenafil citrate, if we're being formal, improves erectile function in over 70% of men suffering from erectile dysfunction. That's right, 70%. Another research piece published in the International Journal of Impotence Research found that Viagra significantly enhanced sexual satisfaction and overall quality of life for men and their partners too. It's not just about the physical aspects, it's about emotional well-being too. And let's not forget the statistics from the American Urological Association. They report that when used correctly, Viagra can increase erectile function in 4 out of 5 men. These studies are testament to the effectiveness of Viagra. While it's not a universal solution, Viagra has proven to be effective for many men. Like any medication, Viagra has potential side effects. It's important to understand these side effects and risks to make an informed decision about whether this medication is right for you. The most common side effects are generally mild and may include headaches, flushing, upset stomach, abnormal vision, stuffy or runny nose, back pain, muscle pain, or nausea. While these are uncomfortable, they're usually not serious and often go away on their own as your body adjusts to the medication. However, there are also some less common but more serious side effects to be aware of. These can include an erection that won't go away, also known as priapism, sudden vision loss in one or both eyes, or sudden hearing loss or decrease in hearing. These side effects are rare but can be serious. If you experience any of these, seek medical help immediately. Now let's touch on who should avoid taking Viagra. This medication isn't suitable for everyone. Men with certain medical conditions should avoid it, including those with severe heart or liver problems, those who've recently had a stroke or heart attack, or those with certain eye conditions. Additionally, if you're taking medications known as nitrates, often prescribed for chest pain, or guanylate cyclase stimulators for pulmonary hypertension, you should not take Viagra. The combination can lead to a dangerous drop in blood pressure. It's also important to remember that Viagra is not meant to be used by women or individuals under the age of 18. It's specifically designed to treat erectile dysfunction in adult men. In summary, while Viagra has helped many men with erectile dysfunction, it's not without potential risks and side effects. It's not suitable for everyone, and the decision to use it should be made carefully, considering both the potential benefits and risks. Remember, always consult with a healthcare professional before starting any new medication, including Viagra. They can provide you with the most accurate information based on your personal health history and current medications. Your health and safety should always come first. There are many myths and misconceptions surrounding Viagra. Let's debunk a couple of the most common ones. First, many believe Viagra is an aphrodisiac, something that increases sexual desire. This is not the case. Viagra simply helps to increase blood flow to the penis, aiding men in achieving an erection. It doesn't spark or boost your libido. Another widespread myth is that Viagra can permanently increase size. Again, this is a misconception. While Viagra can help you achieve a full erection, it doesn't have any impact on the physical size of the penis when not erect. So no, it's not a magical growth pill. It's crucial to separate fact from fiction when it comes to medications like Viagra, so we can understand its actual benefits and uses. As we've seen, the reality of Viagra is quite different from the myths. Viagra has made its mark in popular culture. It's been immortalized in various mediums, from the silver screen to the sound waves of hit songs. Hollywood has often used Viagra as a comedic device, with movies like Love and Other Drugs and TV shows such as 2.5 Men using the little blue pill for a hearty laugh. But it's not all fun and games. The portrayal of Viagra has also played a crucial role in destigmatizing conversations around erectile dysfunction. It's turned a hush-hush topic into something we can chuckle about at the dinner table or discuss openly in a doctor's office. Musically speaking, Viagra has found its way into lyrics across genres. From Kanye West's clever wordplay to Elton John's metaphorical use, the pill has been used to symbolize virility and vitality. Viagra's influence extends beyond just medical circles. From punchlines to plot points, Viagra's presence in popular culture is undeniable. So we've journeyed through the intriguing history of 12 things you should know about Viagra. We've dived deep into its fascinating past, tracing its accidental discovery as a cardiovascular drug to its meteoric rise as a treatment for erectile dysfunction. Along the way, we've uncovered the insightful science that fuels its function, shedding light on how it influences blood flow to enable its signature effect. In the course of our exploration, we have also evaluated the value of Viagra, discussing its economic impact as well as its transformative influence on the lives of millions of people worldwide. In an objective assessment, we've looked at the potential side effects, balancing them against the considerable advantages it offers. Our quest to demystify Viagra has led us to debunk several myths surrounding it, dispelling misconceptions and informing perspectives. We've given due credit to Viagra's undeniable influence on pop culture, acknowledging its presence in movies, songs, and even stand-up comedy. Its cultural significance has been as monumental medical impact. But remember, like every drug or medication, Viagra should be used responsibly. It is crucial to use it under a healthcare professional's supervision. The potential risks associated with its use should always be carefully weighed against the benefits. This video is purely informational, aimed at demystifying Viagra, expanding your knowledge, and addressing any queries you might have. However, it is not a substitute for professional medical advice. Always consult a healthcare professional when medication. Through this journey, we trust that we have provided a comprehensive, in-depth understanding of this significant medication. We hope you have found this video educational and enlightening. If this content has been valuable to you, please hit that like button, share it with your friends, and subscribe to our channel. You're our desire to continue producing more educational content. Also, to ensure that you never miss an update from us, make sure to turn on your notifications. Thanks for joining us today.